We have about 100,000 people who come to Frimley for an accident and emergency service, and unlike most hospitals that tend to use junior doctors outside of office hours to deliver a service, we've got consultants. So there are 14 consultants. They're on duty from 8 in the morning till midnight, 7 days a week. So if you're really, really sick, they're the guys who look after you.
Right.
This building is all about treating those sicker patients who need the input of a consultant. So we've got something that's very special. No other hospital has got that level of consultant input. They're also backed up by a cardiologist with a heart attack centre for Surrey. So if you have a heart attack, you need a stent putting in to restart the blood flow. Our guys will do that. They'll come in at 3 in the morning, 3 in the afternoon, whenever it is, 24/7, and sort you out. That is a unique service.
And a lot of the equipment that you got in there was provided by local residents, because wasn't that all part of the heart-to-heart appeal?
That's right.
Right.
So we've had heart-to-heart. We've also had a previous appeal for resuscitation facilities, and we've transferred that equipment across.
Right.
So we have, state-of-the-art stuff backed up by 14 consultants who are here for you if you really need resuscitation or something really complex, as a procedure or investigation. I can't prove it yet, but I believe that the 14 consultants do save lives and pick up things that the junior doctors perhaps wouldn't.
Yeah, and that's no poor reflection on the junior doctors.
No,
we've all got to learn.
Absolutely.
We've all got to start somewhere, and I suppose
for
those doctors, it's good to have that level of experience here and support.
Yeah,
Right.
very much so.
Fantastic.
And then upstairs, we've got the day surgical unit. 80% of all of surgery at Frimley is done on a day case basis, and the day unit that we've got is too small, so we've got new facilities. So both in accident and emergency and day surgery, privacy has been a big feature of the design. So downstairs you've got private rooms. If you come and you're a sick patient, you can brief the consultant and the nursing staff in privacy, and the same upstairs, you've got your own little room if you come for day surgery. And we see day surgery growing further. So the main reasons for admitting people to the main hospital now are you need a hip or a knee, some big surgery or cancer. The rest of it now gets done on a day case basis. We like it because it's cheaper if someone doesn't have to stop in overnight, and the patients like it because they don't have to bring their pyjamas.
Mm-hmm. To you as the lead clinician, what does this mean to you?
It's a real opportunity to improve the patient pathway. From the point of view where we're standing now, the resuscitation room, it's one of the largest resuscitation rooms in Europe. Each clinical bed space is 5 by 4 metres. It's a huge working area for the team to actually work on the sickest of our patients in a very high-tech, very well-supported clinical environment. Each of the bays in here really is capable of delivering full-blown critical care and intensive care. All the monitoring systems, the ventilating systems are all compatible with our intensive care colleagues, and so the patient can move between the two departments absolutely seamlessly. Where we are on this end of the room, we are right by the purpose-built lift to bring the patient down from the helipad. So again, for our sickest of the sick patients who are delivered to us by our air ambulance colleagues, they'll be received in this bay. They come straight from the helipad, down a purpose-built ramp, through the dedicated lift into the resuscitation room, and then can be handed over to the clinical team.
Right, and so you mentioned the helipad and the air ambulance colleagues. Now there's an element within emergency medicine called the golden hour. Can you just explain that to me, and by having the helipad here, how that helps?
Certainly within the spectrum of time for the injured patient, it's certainly felt that the first 60 minutes from the time of injury are absolutely crucial to the patient. And if you're going to stop major hemorrhage or other life-threatening problems during that time, then that is your window of opportunity. A lot of that initial 60 minutes is taken up with patient transfer. And one of the key things the air ambulance community can bring is rapid patient transfer, as well as advanced medical intervention at the scene, making the patient more stable for that journey. So One of the key things for us with the helipad here was to have that rooftop parking space such that the air ambulance, if they are carrying the patient, can land on top of the A&E department, and then the patient can be just transferred down with a simple trolley push. Our previous helipad was over the other side of the M3 in a school playground, and we're very grateful to the school for supporting us for all these years. But one of the key things was it just is not practical. You land an aircraft there, and then the patient has to be unloaded, placed into a land ambulance, and then driven 15-20 minutes to the hospital. Right. So any time advantage you've made up in the air ambulance journey is immediately lost by a ground journey.
Right, so you basically, by having the helipad, you're cutting 20 minutes off the...
Absolutely, for those kind of cases.
Off that golden hour.
And what we're allowing the air ambulance to do is actually say, fine, we can take our doctor, we can take our paramedic, we can take the patient, and we can transport them in the aircraft, knowing we can land, and then those same medical team can deliver the patient to the hospital, and they can then go back to the aircraft and get back on their way and be stood by for another mission. Whereas previously, there was that long patient journey time, plus then the aircraft crew would have to be taken back to the aircraft, so it was actually offline and not available for emergency response for a longer period as well.
Brilliant. Well, look, thank you very much for your time. It's been a fascinating visit here.
Thank you.
And I'm sure that lots of local residents will benefit from these facilities.
I think they will. It's a fantastic facility, as you say.